Hi, I'm Dr. David Hill, and today we're going to be talking about chronic congestion in infants. So, when I think about congestion, really I'm thinking about gunk up in the airway. I'm thinking about edema in the nasal passage that may keep air from moving, or maybe there's some mucus going on in there. Now, when we use the word chronic, we're usually being pretty specific. We usually mean something that's been going on for greater than 3 or 4 weeks at a time. So if it's not been that long, it's probably not chronic. But let's talk about some things that are not quite chronic. If your baby has had a stuffy or runny nose for greater than 2 weeks, I start to think about sinus infections and maybe ear infections as well. It's normal to have 7 to 10 days of a runny or stuffy nose and congestion with a cold. Happens to almost all babies at some point. But if it's going on too long, if you're really running up on 2 weeks and it's not getting any better, that may be a baby who could benefit from antibiotics. Now, another cause of congestion in babies is reflux, and especially chronic congestion. People say, my baby must not be refluxing because they're not spitting up. Wouldn't they be spitting up? Not necessarily. Sometimes the stomach contents just come right up here to the throat and then go right back down. That's enough to wash up into the airway and cause irritation and congestion without necessarily causing spitting up. So sometimes when we've got this mystery congestion, we treat reflux and the congestion gets a lot better. That's a great thought. Now, there can be anatomic reasons for congestion. There can actually be an anatomic blockage of the airway, a tumor, a ring caused by blood vessels. So sometimes when we can't figure out what's going on, we ask our friends, the ear, nose, and throat doctors, to get a look into the airway with a fiber optic scope and see if they can see something that we can't. They're often able to diagnose some disease or narrowing that we're not able to see with our own instruments. So if your baby has had congestion, signs of airway blockage going on for greater than 3 or 4 weeks, there's probably something that needs to be done, and now it's up to you and your baby's doctor to figure out what that something is. Talking about chronic congestion in infants, I'm Dr. David Hill.